Now, anaplasia. Anaplasia is what? What is anaplasia? Anaplasia का मतलब होता है cells which are undifferentiated. Anaplasia is yeah, a minute. Yeah, anaplasia is cells that become completely undifferentiated, right? So, Roger, you are able to get the point, right? Very good, very good. Now, there are few terms, terminology, which examiner is going to ask us. You have to be very sure. First one, what is hypoplasia? What is hypoplasia? So you have the cells, and the cells became less number, fewer cells. Kam ho gaya. You know what is cell? Cell is this one. Cell sab mile to isko kya kehte hain? Let me ask Roja. When cells combine, what is that called as? What is that? When a group of cells become together, what is that called as? What is that called as? What is the term used for a group of cells together? Come on, Roja. It starts with the letter T. It starts with the letter T. Excellent. Tissue, tissue. टिश्यू को माइक्रोस्कोप में देखने को हिस्टोलॉजी कहते हैं. Histology. Histology looks at a group of cells together, that is tissue. Whereas cytology is the one which is looking at the individual cells. So you should be very sure what is the difference between cytology and histology. So if the cells become decreased, that is called as hypoplasia. Hypoplasia. So in few girls, the size of the breast is very small. In few people, the size of the breast is big. So what is when the size of the breast is small, what you call micromastia. So that is an example of hypoplasia. In few people, that will be of a very large size. That is called hyperplasia. Hyperplasia, right? Now, what is meant by dysplasia? Dysplasia. So, typically, if there is a constant irritation, then what will happen? Suppose if this is the shape of the cell, I hope you are not able to see this. I'll move myself this side. Yeah, so that you can see it better. Yeah, is a broadcast, voice and everything, are they clear, Roja? Can you please punch? Yes. Is the voice, everything is clear? It is not buffering, right? Yes. Very good. Now, dysplasia. So, this is the normal shape of the cell. This became an abnormally shaped cell. The shape of the cell has changed. So, this is an example of dysplasia. But the main difference which you should understand is this typically occurs when there is a constant irritation, like cigarette smoking will make the cells inside the bronchus become dysplastic. But this is reversible. If you remove that irritation, it once more becomes a normal shaped one. Then what is meant by metaplasia? Metaplasia. Typically, in every area, there is a particular type of cell which is meant for that purpose. If you take the bronchus, bronchus has a columnar epithelium, like a column. The cells look like a column. and you have cilia on the top of them. So ciliated columnar epithelium. और एक बार बोलो मेरे साथ, normal epithelium of the bronchus क्या होता है? Ciliated columnar epithelium is what you need to remember. So if there is a constant smoking, then the ciliated columnar epithelium become stratified squamous epithelium. Typically become stratified squamous epithelium after prolonged irritation like smoking is what you should remember. So one cell type has become another cell type. That is called metaplasia is what you should remember. Then what is neoplasia? Neoplasia means cancer. It is similar to hyperplasia, but if you look at the cell nucleus, this nucleus is of a different shape, this is different shape, this is different shape. यहाँ साइटोप्लाज्म ज़्यादा है, न्यूक्लियस कम है. यहाँ न्यूक्लियस बड़ा है, साइटोप्लाज्म कम है. So this kind of different shapes of the cells is called as pleomorphism. Pleomorphism. And this is called as atypia. Atypia. So, Ranjit Shaw is joining. He is in first year MBBS student. Basically, Dr. Ranjit, nurses, doctors, medical students, we are all more or less the same team. Only thing is, right from day one they do service. Nurses do service from day one. As medical students, we read a lot of theory and less practice. That's the only difference, right? So that's the reason always what Mother Teresa said. The hands that work are holier than the lips that pray. The hands that do service and work are holier than the lips that pray. So that is the reason always the rule is, if you go to UK or US or anywhere, nurses are in fact in a lot of aspects more knowledgeable than a junior doctor. Worldwide, that is the story, right? So you take UK nurses or US nurses or anywhere. So the same kind of professionalism and knowledge, depth of knowledge should also come in our Indian nursing education also. That is my whole idea and goal. And I'm so happy Roja is our first student and this is becoming a very popular YouTube portal. Every day 100, 200, 300 new subscribers keep adding as we keep promoting this. And we will be having a large number of students in this live online interactive session. Yeah. So both Ranjit Shaw and Roja, thanks for attending this session. So this is neoplasia. Only neoplasia main thing is the cells are pleomorphic, the cells are atypical, and the nucleus is more darker. That is called as hyperchromatic nuclei. That is an uncontrolled growth. That is called neoplasia. Now comes a very, very important question. What is anaplasia? This was AIIMS staff nurse recruitment exam का question था. Anaplasia होता है a reversal in differentiation. मतलब एक differentiated cell. Cells जो when embryo say when they get created, they will become differentiated. That means every cell has its own shape, look, everything. So that lose the differentiation. That's called de-differentiation. De-differentiation is the hallmark of the anaplasia. That is what a AIIMS examiner asked. Replacement of, the cells that are completely undifferentiated is called anaplasia. Now, I like to ask Roja and Ranjit a question. Replacement of one fully differentiated cell into another fully differentiated cell. Isko kya kehte hain? Just before we discussed. What is the term used for the replacement, there is a replacement of one type of fully differentiated cell into another fully differentiated cell. What is that called as? Ranjit says it is metaplasia. Roja, what is your answer? Come on. So, give one confident answer. What do you call when there is a replacement of one type of fully differentiated cell into another fully differentiated cell? What is that called as? Roja must give a word for this quickly. Yeah. So it is called as I'm waiting for Roja's answer. It is called as metaplasia. As Ranjit said, it is called as metaplasia. Okay, very good. Roja says anaplasia. No, Roja. Anaplasia means a differentiated cell ban gaya, de-differentiated, undifferentiated cell ban gaya. Right? That is called as anaplasia. Okay? Good, good. So, anaplasia is the reversal of the differentiation that lead to development of cancer, malignant, neoplasm is what you need to remember. That means you're going backwards. You're going backwards. So, that is called as anaplasia. So now, how do you recognize anaplasia is a very important question. So you should remember that the nucleus and the cytoplasm. Normally, nucleus is small and cytoplasm is more in any cell. But here in this anaplastic cell, nucleus become very big, cytoplasm become very less. So there is a increased nuclear cytoplasmic ratio is a very important clue. Hyperchromatism, it become more darker nucleus is a sign of anaplasia. That means it is going to become a cancerous cell. It is getting undifferentiated from a differentiated state. Then pleomorphism, abnormal mitosis and new blood vessels, that's called angiogenesis. That's called angiogenesis. New blood vessels when they develop, that is called as anaplasia, is what you should basically remember.